Yeah, so you've got myopia correction being a pair of glasses that restores distance acuity. You've got myopia control, which is instead of prescribing something that just allows you to see clearly, is that we're using something to attempt to slow down how quickly the myopia develops. And myopia management is the whole thing that wraps around that. What's the strategy? Having a look at how quickly your prescription or your axial length is changing relative to some sort of benchmark. What myopia control strategies are available to that particular person, helping the family come to a decision on which one's going to be best for that particular situation. Does it need to be a combination? How many times are we going to reassess how things are going in terms of your prescription and length and those sorts of things? So myopia management is the whole thing put together.
So you mentioned in there about monitoring axial length. So perhaps you might want to unpack that a little bit. Just explain what that means and how you would actually track that.
Yeah, so axial length so we've got the clear window on the front of our eye is the cornea, and then we've got the back of the eye where the retina and the optic nerves sort of leave the eye, and so that's the axis of the eye. So that's the axial length, so the distance between the front of the eye and the back of the eye. Now we know in myopia what actually happens is the eyeball grows longer. Okay, so if we think of this being the front and this being the back, the eyeball grows longer. And so there's a correlation between an increase in eye length and an increase of myopic refractive error. And so as your degree or your prescription goes up, generally it means that your eye length is also going up. And the eye length is a much more reliable way of monitoring myopic growth than prescription alone.
So when you say we can't stop myopia, but we can often slow it down, are you talking about slowing down this elongation of the eyeball?
Absolutely, yeah. And so that's the critical part, is that, and that's the tricky part with some patients, is we might see a relatively slowing of the degree of their prescription, but we might still see that axial length is increasing at a rate that we might be a bit concerned about. And so we wanted to be monitoring both of those things. And so we have an instrument in the practice that one of its key features is it does biometry. So we use a biometer, which is part of an OCT in our practice, which is an ocular coherence tomographer. Fancy names, we just call it OCT because it's quicker and does a number of things, but we want to measure the various shapes and structures of the eyeball. And so axial length is the critical thing that we're sort of monitoring how quickly you're progressing. Now we're looking at how quickly is that axial length increasing relative to someone your age who is not short-sighted. We might be looking at how quickly is it increasing relative to another person who is also short-sighted by the same amount. And we're looking for these kind of benchmarks on trying to slow it down. We are starting to get some treatments that will significantly slow progression and put it on pause. And the trouble we've got is picking the exact individuals that's going to work best on, which is why we have a mix of tools available to us that we can kind of move and shift in between.
So you mentioned a diagnostic tool there. I think is called it an axial biometer. Is that right? And is this something that like every optometry practice would have, or only those who sort of have a particular interest in myopia management?
Yeah, so it's certainly not every practice has one at this stage. So there might be parts of the world or parts of Australia where access to some of these instruments are just not available. Doesn't stop people getting myopia management done. You only have prescription increases as your way of judging how well the treatment's working, and you can have axial length increases with less strong changes in your prescription. So anyone who's getting more serious about myopia management should have a device that measures axial length. So it is an important thing to ask that if if you're worried about myopia and you're getting serious about management, is asking the optometrist whether they refer out to get the axial length measured or whether it's something that they can get measured in the practice itself. And so either of those strategies work.